Hello, good afternoon, everybody. Welcome to our April 20th, 2021 Facebook update. We've got a large panel today with many folks here with a lot of really good information. Myself, Matus, the emergency manager, and I'll let everybody else introduce themselves.
Dr. Renteria, medical director for the tribe.
Public Health Associate with the CDC. My name is Ladan, Mohamed.
Alyson, Littlefield. I'm the health educator through Sewa, Uusim.
And Stephanie Larkins from nursing.
Thank you all for being here. We appreciate your participation. Okay, so I'll start off with some statistics from the Tucson area. For the Tucson area, report date of April 20th, 2021, confirmed positive cases is 1,864. Confirmed deaths is 36. Pasco Yaqui Tribal Health Services testing completed between 3/23, March 23rd, 2020, and April 19th, 2021. Negative results is 11,299. Positive results is 753. And recovered cases is 1,831. For the Guadalupe area, report date of April 16th, 2021. Confirmed positive cases is 1,682. Confirmed deaths is 30. And for the Pasco Yaqui Tribal Health Services, testing completed between May 11th, 2020 through April 10th, 2021. There's 356 positives, and recovered cases is unknown at this time. I'd also like to announce to everybody that we will have another drive-through vaccination pod and scheduled for Thursday, April 22nd, 2021 from 5 p.m. to 8 p.m. And we will be offering the Moderna vaccine. It will be offered to the first 300 individuals 18 years of age and older in the following categories: enrolled tribal members, spouses, or caregivers of tribal members, family members of tribal government and enterprise, SPC, and Casino del Sol employees, contractors for the Pasco Yaqui tribe. So please, everybody, please come out this Thursday evening and receive your vaccine. Just as a footnote to that, the Johnson & Johnson vaccine will not be available for this vaccination pod. Okay, next item is we have another pod upcoming in Guadalupe. It'll be Saturday, May 8th from 6 a.m. till noon. And a public health alert will follow to confirm. So please keep an eye out on the COVID website or Nixel messaging system. Another item that we'd like to announce is the FEMA funeral reimbursement due to COVID-19. The American Rescue Plan has authorized FEMA to reimburse eligible funeral and burial expenses that occurred as a result of COVID-19. The application is over the phone and takes approximately 20 minutes. Please visit the tribe's COVID site for additional information. Another item I'd like to mention is the Housing Department is accepting applications under the Emergency Rental Assistance Grant Program. We're in the process of launching this information on the tribe's COVID site, but in the meantime, paper applications can be picked up at the Housing Maintenance Office. And that's all I have for now.
This is Dr. Renteria. Again, thank you for checking in. I just want to emphasize what Andre said about our vaccination event that's coming this Thursday. Essentially, anybody can come that's a tribal member or casino or government employee, and also family members of those folks, even if they're not tribal. Okay, we're really trying to get the vaccine out to as many people as possible. Our biggest challenge is getting those vaccinated that are between 18 and 25 years old. So for those young folks that are considering it, please come out. And the two young ladies here to my left are going to give you a little bit of information on some projects that we're doing to target that population.
Yeah, my name again is Alyson Littlefield. I'm co-directing a task force here with Ladan, and our goal is to try and understand vaccine hesitancy in youth. We're targeting specifically people aged 16 to 25. And our first thing that we're doing is sending out a survey. So sometime later this week, a survey will be sent out via a Nixle alert and also a physical postcard that we're sending out. And it's just trying to understand, what is it that people 16 to 25 think about what's going on? What do they want to see? What kind of information are they getting, and where are they getting it? Things of that nature. So if you're 16 to 25, look out for it. If you know someone who's 16 to 25, please encourage them to finish our survey. That's it for me.
Thank you. Thank you.
Landon, do you want to add anything? No? You good? All right. Hi, everyone. I came today to talk about the Buy Next Now test. So as everybody knows, we have our own testing site here at the CET Annex by the Cultural Grounds and at Alternative Medicine. We are trying, Dr. Renteria and the Health Department are trying to think outside the box on ways that we can start up some of our support groups here within Center Spirit and within cancer, the health department, cancer groups. So we were offered the opportunity to come into play with a testing kit that can be done on site. And so this would be something that community members, it's a simple nasal swab and it's a little card, results in 15 minutes. If you're negative, you get to come into the support group. So we're working on ways to roll that out so we can get some services open back up to the tribal community here. So please be on the lookout for information coming from different departments. And Dr. Renteria, do you want to add anything to that?
Mm-hmm. The other issue that this will address is Tribal Council is trying to get the employees that have been at home back on site so they can maximize services. So this type of testing will also help us address those employees that are not vaccinated so that we can control the risk to any community members that come to get services so that we can have the safest environment possible.
That's right. And the test is about 97.1% accurate. So if you do test positive, because this type of test is considered an antigen test, so it's testing a specific protein on the coronavirus itself. So if you do end up testing positive, then we would just send you through either to the CET Annex here or AltMed, or if you're testing using these tests in Guadalupe, to the nursing department up there for a PCR test, which is what we're using at the CET Annex. So it's pretty invasive, and it lets us open the doors a little bit and still be cautious. Of course, these groups will be in a larger room, still social distancing, using masks, washing hands, all of the things. But hopefully this is a way, again, to open the door to allow some members to get some much needed services. So we're working on it. So that's pretty much my update. And please come out to the vaccination event on Thursday from 5 to 8. It was gorgeous last week. The radio station is out there. They're playing some music. And again, we want to target that 18 to 25-year-old population, but we continue to see all ages come out for first doses. So I encourage you to come out and visit us on Thursday from 5 to 8. Thank you.
Thank you, Mrs.
And if you're due for your booster around there, also come.
Yes, if you're due for your booster, most definitely come out and get your booster. If you have any questions, you can give me a call.
Is that booster date on here? Should I?
Yes, yeah, you can.
Okay, so if you received your first dose of the vaccine before March 17th, you have missed your second dose of the vaccine and can receive it this Thursday, April 22nd, 2021. If you received your first dose of the vaccine March 18th, you are due for your second dose of the vaccine on April 22nd. So please, look at your card or, set up a reminder somewhere, but come on out, please. We encourage you to please come get that second dose so you'll be fully vaccinated and not only protecting yourself, but your community as well. Anything else I missed, guys, on the flyer?
I just want to add, there might be some people out there who think, wow, you know, I really am way behind on my second dose and maybe or even later than those dates you mentioned. The reality is, the recommendation is just get your second dose no matter how long ago it was, because the 2 doses are better than 1, at least from the data we have right now. So even if you think it's been a little while, just come get your second dose.
Awesome. Quick question, will they have contact numbers for both of you as you put out your distributor?
Yeah.
They should have my
information?
email at least.
Okay.
It'll be in the information you sent out, correct?
Yeah, yeah.
Okay. So, as you've heard, a lot of good information here from our panel, and you'll be receiving more information, so please don't hesitate to log in again. I'm gonna remind everybody that our mass messaging system, all you have to do is text PY Tribe to 888-777 and opt in, and you'll be able to receive everything from the public health alerts that these folks work on to the survey that they're going to put out. Just any information COVID related, you can receive it there, and you can also receive it on our COVID-19 POSCO-YAKI-NSN.gov website. So please, you know, continue to help us. We're getting really close with the vaccines. We're still continuing our testing, but we're not through this pandemic yet. So we don't want anybody to let their guard down. Please continue to obey all tribal ordinances that are in place now. Continue to wear your mask, sanitize and wash, and keep your social distancing. It's really important that we continue to do those things because we don't want to, you know, as many people say, you know, let your foot off the gas pedal and slow down now when we're so close to, you know, to recovering from this pandemic. So please, you know, just keep trying to protect yourself and the rest of your family and your co-workers. And we thank you for your time. Thank you. Bye-bye now.
Bye-bye.
Bye-bye.